Hey there, welcome to Women Blazing Trails. My name is Eva. Today we're going to talk about the cost of healthcare, or I should say, like if you have a healthcare emergency. Here in Guatemala, I recently had one. Actually, it's been going on for the last 3 weeks now. Um, I've been kind of sick, which is probably why I haven't produced any new content lately. I'm really sorry. My health comes first. So we're gonna talk about that today. What it cost me because I don't have health care insurance here. Though after this, I am going to look into getting healthcare insurance because as a foreigner, I can buy healthcare insurance here through my bank or something. We're going to look into that. So we're just going to get right to it. I had some, and without getting all long and boring about my condition, I really just want to talk about the healthcare system and the cost as opposed to all my ailments and what I was suffering with, because that's just long and boring and nobody really needs to hear any of that stuff. So I had some pains, my entire torso. I woke up one morning and I was just like in excruciating pain. I could barely walk, breathe, stand, sit. Like I just couldn't do anything. And it just literally came out of nowhere because I'm a pretty healthy girl. Like I go to the gym, I eat healthy. So I don't know what the fuck happened. So I went to the doctor. I think I waited till like the next day because I thought maybe it was just gas or something and it was gonna go away. So I waited till the next day. I went to the doctor, emergency doctor, the next day at the public uh, health clinic. It's a medical clinic here. And I'm gonna convert everything. My initial exam for the to go see the doctor was 295 quetzales. I'll convert everything. So it's 295 quetzales for just to see the doctor. And then so he ordered a bunch of tests. I had to have some blood work done. The blood work was, oh, I forget how much that was. It was like 75 quetzales or something. I had to have a CT scan. That was 4,000 quetzales. So once all that was done, then he gave me some antibiotics, and they were kind of expensive. It was just two packs, and they were over 700 quetzales. So I started the antibiotics like the next day, and the day after I was 10 times sicker than I was the few days before I had gone to see him. Like I felt so much worse. Like it was really bad. So I decided to go to a medical center in the city because there are better doctors, if you will, in the city. I don't want to shit on anybody, and I hope I'm not hurting anybody's feelings. I think the medical care might be a little bit higher level than the medical care here. So I took an ambulance there because the traffic through the city, you can sometimes sit in traffic for an hour or 2 hours to get to your destination, and I just was not well at all. So I took an ambulance. The ambulance cost 900 quetzales, and it was the ride from hell. I threw up the entire just bile because I hadn't eaten. I should have said I hadn't eaten anything all week because I had no appetite. So I literally just puked bile for like 2 hours. It was horrible. It was horrible. So anyway, I got to the clinic, to the medical center, and the doctor took me in right away. And there's like a little private hospital, I guess. So they took me into the hospital. They admitted me. They hooked me up to IVs for hydration and pain management, and ran a whole bunch more tests. So I was in the hospital for 3 days. They didn't actually give me food till the third day. Like they wouldn't feed me the first and second day. So needless to say, throughout this entire process, from the time I got sick 3 weeks ago to today, I've lost almost 10 pounds, which is an awful lot of weight for me because I'm a very small framed person. So losing 10 pounds for me, almost 10 pounds, makes me just feel really sickly and anorexic looking and just weak. Not a very attractive look for me. So I'm hoping to gain at least 5 of those pounds back. So anyway, so no food till like the third day. Oh no, I think the second night they gave me some like creamy soup. I called it cream of dirt because I couldn't recognize it. I didn't know what it was, so it just tasted like dirt. So, and I had jello. I had jello. Oh, I had jello the second morning, I think. No, the second night they gave me jello. Then I had jello. Oh, I love jello. Anyway, so sorry, I went off a little bit on jello. Jello makes me happy. Even just looking at it makes me happy. So 3 days in the hospital. I had really, really good care. So there I had um, ultrasound. I had an ultrasound here too. The ultrasound here was 300, no, 275 quetzales, I think. So I had another ultrasound there at the clinic, at the medical clinic. I had ultrasound, I had blood work, I had P tests, poo tests, x-rays. I had x-rays here too. So I've had like a shit ton of tests. So the total cost at the hospital, because I really was like just bracing myself for the bill, because it's 3 nights. It was 3 nights, I think, and medication and the doctor and I just I didn't know how much this was going to cost, and I was kind of afraid. So 3 nights in the hospital, 3 days, 3 days, 3 nights at the hospital was 19,000 quetzales. And so that's all the medication, which I found the medication was really expensive because I went over my bill. Medication was ridiculous. Like the medication alone was like almost 8,000 quetzales for medication. I thought that was a lot, but what do I know? So a little 19.5. I think it was 19.5 at the medical clinic. My friend was with me at the hospital the whole time, so he had his car, so I didn't have to take the ambulance back home. He drove us home. Then the doctor prescribed me medications for when I got home to get. So the medications were 350 quetzales, and I still have to go for a colonoscopy. Wah, wah, wah. Like who wants to go for one of those? I have to go get one of those. I'm not looking forward to it, but I'm going to do it. I actually thought about like just not doing it. I'll just like fuck that. I just don't. I'm fine. I don't need one, but I feel like I need to be really like vigilant right now with my health because I am over 60 now. And little things like this pop up that make me go, what the hell is wrong with me? What is going on with my body? That can be kind of scary. So I am going to get a colonoscopy. The colonoscopy is 2,400 quetzales, and that's coming up next week. That's 2,400 quetzales. And you have to drink those things, liquid stuff. I have 4 pouches. That was 350 quetzales. So it's been a little bit of an expensive ride, but everybody keeps saying, "Oh my God, Eva, you got off easy. If you were in the United States or if you were in Canada, you would pay." Well, if I was in Canada, I would have health coverage because I had OHIP. I don't anymore because they kind of canceled. They completely canceled me from Canada, which is fine. I don't live there anymore, so why should I still enjoy the benefits, right? I don't live there. Fair is fair. So, but anyway, so my friends did say that if I did live in the United States, I would be looking at like tens of thousands of dollars. Like my bill would have been astronomical. So my bill was only 19,500 quetzales from the hospital, which is $3,500 Canadian because I'm Canadian. So it was $3,500 Canadian for 3 days at the hospital with decent care, testing and all of that stuff. So that's how much we're going to put the total here. Grand total. There's a grand total of my entire 3 weeks, including medication, ambulance, everything. So I'm very, very, very fortunate because I just sold one of my websites and I made a decent profit on it. So I had that money set aside. So I'm very, very blessed. It's funny how the universe works. I mean, I would have been fucked. I'm sorry to say that, but if I didn't have that money from the sale of my website, I would have been screwed. There was absolutely no way. I would have had to have begged, borrowed, and stolen to get to pay for that, all of these medical expenses. So I'm very, very fortunate and very, very blessed um, to have had that sold that website just in time for my health to fail. It's funny how that works. That's not funny at all. But anyway, so I was able to pay for my health care, thank God. But it was a big, to me, it was a pretty big price tag, I think. So I'm going to look into healthcare insurance and I'm going to see how much that costs. Because clearly my body is just, it's just starting to act up, and I need to keep on it and try to stay healthy. So I've been doing fasting, full 24-hour fasting to help my body heal. I haven't really had much of an appetite. It kind of comes in waves. Um, but I've been doing a lot of fasting, and then eating just clean, like clean meats, eggs. Um, what else have I had? Cabbage, like just real raw food, like whole food. And I seem to be getting better. I feel better today. Tomorrow I'm back to the doctor for a final checkup. Um, so it turned out that I have a slight kidney infection. There's bleeding on my kidneys, and there's like fungal growth on my kidneys, which is really weird. I don't know where that came from, but he said that was part and parcel for having a UTI. So maybe they didn't quite say I had a UTI, but he thinks I might have had a little bit of a bladder infection or urinary tract infection without actually saying I had a UTI. It was kind of weird. Anyway, I'm on the mend and I'm feeling a lot better today. I feel so much better today than I have in 3 weeks because I've been in a lot of pain. I've been very uncomfortable. I've been very sick, and just resting a lot. I haven't even really been working very much, just resting a lot, um, and trying to heal my body. So, anyway, so there is good health care here in Guatemala, even though it's still labeled a third world country. There is good health care here. Um, it is relatively affordable. The clinic here was very affordable. All the tests can be a little expensive, but my health is worth it. Without your health, you have nothing. And I'll say that again. If you don't have your health, really, you don't have anything because I couldn't work. You're miserable. You're depressed. You're sad. You have immobility issues. You can't do so many things. I mean, your health is everything. You could have $1 million and be sick, and you're going to be poor. You won't. You're not going to be rich. You're going to be poor. So take care of your health. If I had to, I'm going to drop a link down below to a blog that I just wrote about 11 ways to take care of your health because I'm over 60. I don't know about you guys, whoever's watching, but even, if you're nearing 40, 50, 60, if you're just getting there, you have to start taking care of your health. If you haven't in the past, if you've just been, I'll just eat that and I'll go to the gym tomorrow and I'll keep smoking and I'll keep drinking bottles of wine and I'll keep, well, that's only going to last you so long until one morning you wake up and it's all going to catch up to you. And your body's just going to say, yeah, we're done. We don't like this life anymore. And this is your warning sign. This is your warning call to stop doing all this toxic stuff to our bodies, to my body. Stop it. We don't want to do this anymore. So you definitely can start making little changes to your health, to your daily routine. Just start making little changes. Maybe drink a little bit more water or stop drinking pop. Like if you drink, sugar is poison. So if you're drinking pop and eating lots of sugar, like cut all, like stop, just like dump all of that. That's poisoning your body, you need to stop doing all that. Um, you can replace, I know it's not the same, but it's healthier. You can replace pop with a water with lemon or mint leaves or cucumber slices. You can dress up your water and make it taste good. It's not going to taste like pop, but it's going to be a hell of a lot better for you than pop is. Stop eating out so much and start making dinners at home. Like, there's so many different ways to take care of your health. And now's the time to start. Like, now's the time, because this sickness, whatever, it came completely out of the blue, no warning, no nothing, completely out of the blue, totally caught me off guard, and I just kind of like, what the hell is going on? Like, what is happening? So it could happen to you. I mean, it can happen to anybody. So now's a really good time to start taking care of your health. So that's all I got. I just wanted to share that with you. Why taking care of your health is important, what the cost of a medical emergency is here in Guatemala. And I didn't even have surgery or anything, so I can't even imagine how much it would have cost if I had to have surgery. Thank you, God, that I didn't have to have surgery, and that I nipped this and got this taken care of right away. So, and listen to your body. Like, if you have new aches or pains, or something doesn't feel, go to the doctor and go and have it looked at, because that's like, your health is so I don't know how to say it. Your health is so important. I can't say it any more powerful or any more, like, to make you understand that your health is so important. It really is. I've been 3 weeks. I've barely been able to work. I rest a lot. I've barely been able to eat. I am eating now a little bit better, but that wasn't Eva a month ago. I was happy and bubbly and healthy and eating and working and blah, blah, blah. And it all just came to a screeching halt. So your health can change that fast, like that fast. So, okay, I don't want to make this long and boring. So take care of your health. That's how much healthcare costs in Guatemala. And I hope you did enjoy this video. I'm sorry, I've been kind of MIA for a while, but I have a really good excuse. So don't forget to like, comment, subscribe, share if you feel inclined to do so, all that good stuff. And I'm going to drop a bunch of links down below. I would love it if you went and checked out some of the links to my site. Some of my blogs need some love. If you could just go check out some blogs that need some love and all that stuff. I love you guys. Thanks for watching, and I hope you all have a great day. Bye for now.